Ok. Bueno, muy buenas noches para todos. Tenemos hoy el gusto enorme de tener con nosotros, gracias a la impecable gestión del doctor Mauro Verna, de contar esta noche con el doctor Tracy Turner. El doctor desde pequeño está involucrado con la actividad de los caballos. Uno de sus primeros trabajos fue de herrero en el año de 1972, lo que le permitió para pagar su educación de veterinaria. Recibió su título de veterinario de la Universidad de Colorado en 1978. Es diplomado por el Colegio Americano de Cirujanos y de la Asociación de Medicina y Rehabilitación Deportiva Equina. Fue profesor de la Universidad de Illinois, la Universidad de Florida y la Universidad de Minnesota. Se unió a la práctica privada en 2004 y estableció su práctica en 2016, dedicada estrictamente a medicina deportiva, claudicaciones y cirugía. Es un especialista en el área de termografía, uno de los pioneros de esta modalidad diagnóstica en el mundo. Tracy, welcome again to this virtual room. It's a pleasure to have you here for this Latin American virtual room. We are so happy to have you here. We are excited of this conference, and you can begin when you want.
Okay, terrific. It's thank you for inviting me. I will try to speak slowly, but those of you that know me know that that's hard for me. But if there's questions, we hadn't figured out how to ask questions, but I can give somebody my email address where they can communicate afterwards to ask more questions, or if we have a question and answer period afterwards, that's great too. So without further ado, let's get started to just discuss thermal imaging and how it applies to equine sports. The first question that needs to be asked is what is thermography? It's been described as a bunch of pretty pictures to BS people, but it's much more than that. If we look at how we image our patients today, we can divide up our imaging into anatomic imaging and physiologic imaging. Our anatomic imaging includes radiology, ultrasonography, computed tomography, magnetic resonance imaging. Anatomic imaging is what we were really trained to do. I mean, we went through anatomy classes to understand anatomy. Anatomy is something that you can touch, feel, taste, whatever. Physiologic imaging, on the other hand, is something that happens. It's the body's mechanism, if you will. What do we commonly use? Scintigraphy is physiologic imaging. And what scintigraphy measures, at least what we use in veterinary medicine, is most common the bone scan. And what it's measuring is osteoclastic activity in the bone, a very simple measurement. Now, included with that as the physiologic imaging is thermography. And what is thermography measuring? It's measuring the body's heat and how that's produced and how it's distributed. So in theory, if I have a horse, that body there continuously emits heat energy. Heat is in a wavelength, and from the mammalian body, heat is emitted in the infrared region of light. So if we imagine that horse emitting infrared radiation, then I can have a camera, like a gamma camera, or like an X-ray plate that measures the generated X-rays that onto it for radiography. But here what we do is we're going to have a camera that measures the infrared radiation from that body, and then it's able to take that and produce a picture of the heat that's been emitted from that horse. So each color that's assigned is a temperature, is a small temperature range. True thermography, if you will, from electronics point, is really just a continuation of black and white, depending on the intensity of the irradiation that you get. But now with computer chips and stuff, we can assign colors that make it easier to see, etc., and hence the picture. So You might ask, what physiology does thermography measure? It measures local circulation, because that is what our body temperature is due to. Okay, so it's going to measure local circulation. It's going to measure actually the rate of blood flow. So the higher the blood flow, the more the body's heat is coming through, and then it can be emitted through the skin. And then finally, local metabolism of the cells themselves. So the cells are producing heat as they generate energy. So thermography is actually measuring those three things as a physiologic measurement. So for us as clinicians, thermography is essentially the pictorial representation of the surface temperature of an object. So now I have a picture to look at that instead of using your hands or whatever. Now I have a picture representation that tells me how much heat is in that body versus anything else. Now, when we combine that information with a thorough clinical examination, it's extremely useful in identifying soft tissue injuries that may have otherwise gone undetected. Because remember, the cardinal sign of inflammation anywhere, number one, is heat. In equine medicine, I have found 4 common uses for thermal imaging. We probably could put more in there, but we can put them into four areas. One is as a diagnostic tool to help us come up with an answer when there's a problem. 2, as an enhancement of the clinical examination. So as you go through a clinical examination, it basically provides information that you didn't know. So it provides extra stuff. So if you're doing a clinical examination, now I have a measurement or I have a qualitative measurement of blood flow. It can be used as an assessment of training stress, or at the same time, it could be an assessment of rehabilitation stress. So as we put an animal back into exercise, that exercise creates stresses and strains on the tissue. And by knowing what normal is and what that animal's normal is, then you can see if the training is putting too much stress on any one area. And we'll talk about all these. And then finally, it has a use in regulatory medicine. For all of you, where it's going to be used most commonly, you'll see it is in FEI show jumping competitions, where it's used to assess hypersensitivity. So it's used to help us control the welfare in horses. So let's go back, talk about the physiology. Heat is perpetually generated by the body. And in fact, all objects above absolute zero will emit radiant energy. And it's continuous. Now, that heat that's generated body is dissipated through the skin. And hence, that's why we can now measure it. So all heat has to be, it's gonna be measured in different ways. So radiation is the biggest one. So we just radiate heat, but also convection. In other words, a breeze or anything can come by. So that's why we like standing in cool breezes or in warm breezes, whatever, that can warm you up. Conduction, that would be the touching of another object. So during the summer, if you touch a metal rail, it's got a lot of heat in it, and you can even get burned from that. That's conduction of heat. Or likewise, if it's really cold, it can do the same thing. So that's conduction. And then finally, you dissipate heat through evaporation. Now, when we start to look at thermography, those convection, conduction, and evaporation are all the causes of artifacts that may happen while you're doing thermography. And so environmental factors can cause each one of these. So a breeze can cause convection, anywhere close to a object that's emitting heat can cause conduction, or if the environmental temperature gets high enough, evaporation will start to occur because sweating starts to occur, and that can interfere with what you're trying to look at. So those are the things that we have to look at and control. Now, back to how can we use it. So again, inflammation. The 5 cardinal signs are heat, pain, swelling, rubor, and loss of function. Now, typically the horse is brought to you because loss of function. So in order to find where the issue is, we can use heat as one of those signs to help us determine. And thermography is a useful tool, and that's what it is, a useful tool to get you to the location. So as we start to look and read, look at thermal images, what you have to understand here is what I call the thermal pattern. The thermal pattern is dictated by the circulatory pattern. So wherever the blood vessels are, that's the main heat source. Okay, then also local vascularity. So certain areas have more vasculature in them, like the coronary band, and those are naturally warmer areas. And then finally, surface contour. So areas of the body that have concavities actually have more skin per square inch as you look at it as a flat object, because the thermographic camera can't distinguish contour, so it sees everything as a flat screen and what heat's emitted from that. So a concavity tends to have more heat in it than a convexity. And so when you look at an image and you see the blood vessels, and then you look at the thermal image, you can see exactly that here. So we can follow the vasculature as it comes down. Here we can see a concavity, because this is that area, the suspensory ligament is right there where the yellow is. The red is a deep concavity, and then back to yellow when we're over the cannon bone. So you can see the pattern really does mimic the circulatory pattern really well. As you look further, so the midline is generally warmer. So when we look at the back, down the middle of the back should be the warmest area, and then we get these isothermic bands. As we look at the chest of the horse, again, the middle of the chest is pretty warm, and then as we get further out, we get more bands. The chest of the horse is a little more odd because you have these large muscle masses, and we'll discuss a little later on. Muscles are great generators of heat. We look at the rump and the croup, and what you can see, the croup temperature is warm down the middle, then over the top between the tubercocci, and it sort of forms a T, if you will. And then right over the gluteals are relatively cold areas, and these are very consistent. And then we look at the horse's rump. You can see there's oftentimes a little heat over the hamstrings, but when you lift the tail up, really between the concavity there is the warmest area, and then you start to get isothermic bands there. So you just have to think, as you start to look at thermography, you have to always think about the physiology of the area, of the circulation of the area, of the surface contours of the area, and you can imagine what it should look like. So as we start to look at the extremities, the thermal images, the hottest areas always follow the vasculature. So here in the front leg, you can follow the cephalic vein, and looking at the veins to be that. In the back leg, the saphenous veins. And I call these sentinels of temperature, because no other object should be warmer than what's traveling in the veins. So if I have a skin area over a joint that's as warm as a vein, or is approaching the temperature of that vein, that's a lot more heat than supposed to be there. So therefore that would become an abnormal pattern. So more when we look at it. So again, as you start to look at an area of the horse, think about the circulation. So if we look at the lower leg of the horse from the front, from the dorsal view, it's relatively cool. Why? Because there's no large blood vessels there. Not until you get down to the coronary band, which is a complex of vessels, very hot, and that will always, should be always the warmest area on the foot. And warmest area in the leg, unless there's some other reason for it, which is usually inflammation or other factor that you should be able to explain. Then you go to the tendons. Again, the tendons themselves, as you can see here, have very little vascularity. And so they tend to be relatively cool. We start to see more heat in between the bulbs of the heel of the foot, which is a deep concavity. And on here on the inside of the leg, you can see more heat because that's where the vasculature is on either side of it. But right directly over the tendons, very cold because there is no circulation there, or very little. And then when we look at a lateral or medial view, again, it shows it just like we've been showing it. You can follow the vasculature all the way down to the foot in the major vascular zone. So that's where heat should emit from. We get to the foot, the coronary band and laminar corium are always warmer. And then followed that by between the bulbs of the heel. These are always the warmest areas, and I always use these as sentinels of that. Nothing else there should be warmer than those spots. And anything that does show up to that temperature is not normal. So how do we use thermography in the lameness examination? One, you're going to go through an evaluation of the gait, go through your palpation, go through manipulation tests, and then I'm going to perform systematic thermographic examination. So why do I go through all these things first? Why? Because I'm trying to pick out the abnormality. I'm trying to disturb the inflammation, if you will, so it makes it easier to see. You can look at the horse right out of the stall, but oftentimes because the horse isn't using the leg or it's resting the leg somehow, it'll disturb the circulation and it makes it more difficult to look at. As a matter of fact, it can even frustrate people because they'll find that the lame leg's actually a cold leg because the horse has been resting it, not been using it, therefore it doesn't have the circulation to it. But if you get the horse out, you start to move it, manipulate it, and making it more sore, like you would try to do anyway during a lameness examination, we can start to bring out that inflammatory spot. So that's why I do all these tests usually before I perform my thermographic examination. And then thermography is performed in a systematic manner, so I cover the entire horse. So what am I looking for if I'm utilizing thermography as a diagnostic tool? So I'm looking for signs of inflammation, and thermographically, that's going to be detected either as a hot spot, which is the classic. Everybody's looking for the hot spot there, and the lesion will be focused over that spot. But cold spots can be equally important. And so both of these I've shown you, this is a palm review of an injured tendon showing a hot spot right there. But this is a very acute tendon that I got on a cross-country course just after the horse came off the cross-country course. The rider pulled up because the horse became sore. And what you can see is a very intense cold spot over the injured area. Why is that cold? It's because one of the things that thermography is really good at is giving you an assessment of the autonomic nervous system. So as soon as you're injured, the sympathetic nervous system comes into play and it vasoconstricts all around that area to prevent hemorrhage and everything else that can occur there. So we can find these cold, relative cold spots because the circulation has actually been cut off momentarily. Now, over a period of a short period of minutes to hours, this area then becomes intensely hot. We just happen to catch it at that physiologic period when it's vasoconstricted. So classically, the hot spot is associated with localized inflammation, and the lesion that you're looking for is directly underneath the hot spot. So if I ultrasounded this area, I would expect to see the most severe part of the injury in this area and less severe changes as we get around it. So that's the hot spot. The cold spot are more complex. So the diseased tissue may have reduced blood supply for any number of reasons. One, swelling. If you get enough swelling, it cuts the circulation off. Two, if you get thrombosis of vessels, cuts the circulation off. If you get an infarction of tissues, it cuts the circulation off. Scar tissue, dense scar tissue will tend to be very cold. So there's an idea. Over time, as it tries to revascular, you can get increased circulation, but that's takes a long time. And then finally, sympathetic tone, and sympathetic tone is very strong. And then human medicine, they use that a lot, and thermography is the diagnostic method of choice to determine a painful condition that's associated with increased sympathetic tone. It goes under various and sundry different names, but it can be called Raynaud syndrome, reflex sympathetic dystrophy, and today here in the States, they have new names for it, complex pain syndrome. And it's associated with increased sympathetic tone, due to any number of causes, but it's a common issue for human workers. So as we use it as a diagnostic tool, there's a couple of things we're trying to look for. Now, classically, it's described as a 1 degree centigrade difference in temperature between 25% of symmetrical anatomic areas indicates pathology. And that's a lot to say. I say that and it just blows my mind. I much prefer to look at patterns. And so here on the right stifle of this horse, we see a relatively normal pattern over the stifle. This is the area of the patellar ligaments. The patella sits right here. This is the line of the medial patellar ligament. And it's a very sharp demarcation between the cold over the patellar ligaments and the inside of the thigh, very sharp demarcation. That's a normal stifle with my muscles surrounding it. The left stifle's not so normal. You notice that my line has really been disrupted. I don't have a straight line through here anymore. And I have heat that's coming across, affecting more of the joint, and I have more heat coming around the outside of the joint, indicating that the horse is no longer using the stifle properly. So with this abnormal pattern, which I think is easier to see than trying to figure out these measurements, that's the place we need to look for inflammation. Now, the stifle is one of the more complex joints. Most joints you can look at, when you think about it physiologically, think about where the joint capsule is for that particular joint, because that's where the heat will come. So when you have a large joint, tends to be cooler in the middle and warm around the edges. If you have flat joints like hocks, etc., they will be nice flat lines of inflammation when you see them. So when we've gone back and looked at where thermography was the most useful as a diagnostic tool, number one was when we used it to evaluate back. Hind limb was most common, and upper limb lamenesses. And if you think about it, these are always lamenesses that are more difficult to deal with. I mean, the back, frankly, from a palpation standpoint, it's a matter of opinion. Is this painful, or is it the horse acting up, etc.? Now I have information that says, no, my thermal patterns are abnormal, and they indicate this is the region where you need to go look for pathology. We found thermography to be extremely useful in the evaluation of poor performance or in pre-purchase. In fact, this is the second most common use, and mostly in the poor performance in horses that may not really be lame, but the owner rider sees a problem with the performance. And we can use this to detect areas for further investigation, to look for injuries or other abnormalities that may be causing our problem. And then finally, the number three was the evaluation of forelimb lamenesses. And I will admit myself is that I think I'm a bit of a snob when it comes to lameness, and I think I can figure out most of these because I can block them out or etc. But there's still, if you think about it, there's a lot of information that you can gain by knowing what the circulation is of the limb. And I have been remiss in using thermography as much as I probably should. But when I need to pull it out, it's most commonly for back and hind limb or for poor performance. Other things to consider is when you consider thermography as a physiologic tool, you're evaluating the whole horse, not necessarily just one limb. And as you start to evaluate the whole horse, you get this whole concept about how the horse is using itself. So here I've just shown you, here's a horse with a hot shoulder, the left shoulder, its diagonal hip. You can see increased heat in that hip, showing how the way the horse moves, the diagonality of a lot of these problems. If I have a problem in the left shoulder, I'm most likely to see another problem in the right hind. And you start to see this, so that even though I can find the primary part, I have other parts I need to address if I want to get this horse back to full performance. So thermography is one of those tools I think lends itself really well to looking at this whole horse concept, so to speak. So a change such as a lameness in one leg will cause changes in other limbs, and now this is a way to measure that and have a quantification of those sort of things. So whether and even if you're doing other things, say such as chiropractic, acupuncture, etc., where people find these frequently too, this is a tool, an imaging tool now that I can see the same thing. So I always like to bring this up. Does lameness diagnosis ever frustrate you? I'd never admit it, but it can be frustrating, especially upper limb lamenesses. You know, upper pelvic region, upper shoulder, neck regions. I mean, these are exceedingly hard places to block a lameness out. And oftentimes I really feel they become a matter of opinion. You know, especially, I don't know if you're seeing it down in South America, but every other horse seems to have a sacroiliac problem. And let's face it, I just don't think they're that common. Other things happen. Or you have a lameness that somebody just knows there's a problem, or that's the complaint, but when you look at it, it's just too subtle to use diagnostic analgesia on it. I mean, I can see an abnormality, but I couldn't swear that I could block it out because it's just so subtle. And this may be, you know, being ridden or anything, so that those can be a frustration. And finally, I don't know if you've ever met this horse, but there are certain horses that just are not amenable to diagnostic analgesia. They just don't like getting injections. And I'm old enough now, and I don't have resonance anymore to sacrifice, so I need some other way to look at these horses without dying. And thermography can help that. So thermography as a diagnostic tool, imaging is useful in localizing the region of the injury, but it does not characterize the specific nature. So even if you use thermography, you're still going to have to come back and use radiography or ultrasonography or something else to try to get an anatomic imaging so you can characterize the nature of what you're dealing with. So it truly is a diagnostic tool that helps you improve your clinical examination. Here's some places where I found it most helpful. You know, back pain. Years ago, people used to argue if it's real or not, and a picture's worth 1,000 words. So on the left is a normal back, and on the right, here's a horse with an injured wither. So we see a lot of inflammation in that area. You follow this up with some radiography, and actually this particular horse here had a fractured withers. Here was one with a dorsal spinous injury. The thermography as a diagnostic tool, we were able to look at hundreds of these horses, had a sensitivity of 96%. I mean, thermography just doesn't miss them. Specificity of 82% because of that's a finding specific dorsal spinous injury. And I think most important, a positive predictive value. So meaning if I see one of these patterns that we've associated with dorsal spinous process injuries, I have a 90% chance that that's exactly what I'm dealing with. We can look at the sacroiliac area. So here's a normal sacroiliac, or relatively normal. It's warm down the middle, same temperature from tubercocci to tubercocci. We have some little abnormalities over the gluteals, but here's a real abnormal sacroiliac area. So the tubersacrali are here. So I have one warm one cold one, and I have a great disparity between the left croup and the right croup. So this is, yeah, we got problems here, and I've got cold for some reason in this area, and it needs to be investigated further by other diagnostic means. And for me, that's ultrasonography of the region to look at it. So we have had excellent correlation between thermography and anatomic imaging. So again, we have these three different patterns we recognize associated with dorsal spinous process injuries, and when we radiograph them, boom, we find them consistently. Same with the sacroiliac area. So here's that image again. We come back, we can ultrasound that. We can ultrasound the sacroiliac joint itself. We can also ultrasound the ligaments. So in this case, we found differences we found desmitis of the dorsal sacroiliac ligaments, the ligaments right over the tuber sacrali, looking for injuries there. Here's a bicipital bursitis. We got a lot of heat, big abnormality, heat over here. Come back and we ultrasound that area and find changes. There's a lot of increased fluid in this bursa in this particular one. So how does thermography enhance our clinical examination? And again, it comes back to this phrase of thermography provides information that you didn't know. Meaning that I didn't know that actually was inflamed over there because I didn't detect it the first 6 times I looked at it. So this thermal image is actually on a horse like that. It's a horse we saw at a racetrack. The complaint was the horse just wasn't training right. They've had it looked at 3 times by the veterinarian, and nothing seemed to miss. Couldn't find an area specifically to really look at. Going over the horse, didn't find anything. Horse flexed up fine. And so we thermographed the horse, and what you can see is this increased heat over here behind the left hock. Followed this up with ultrasonography, and comparing the two, found some minor changes in the superficial digital flexor tendon on this hind leg over here. The horse was treated appropriately and then went on to have a successful track career. But again, who's going to look there on a horse that's just starting training? I mean, you couldn't find it, been over it, missed it. So if we look at and think about our clinical examination, any examination involves careful palpation, manipulation to determine if an injury exists. Imagine for a moment if you could take those palpation skills and you could increase your palpation sensitivity by 10 times. In other words, as you're moving over there, man, I can feel a knot and tell you how big the knot is in the muscle. I can feel muscle fibers, and I can tell you which fibers were actually torn. That'd be pretty cool. Thermography actually does that for you in your ability to detect heat in an area. And so that can allow you to take that information and find areas of possible injury that you didn't necessarily know you had. So here we have, this horse came in for a splint, but we found a little extra sensitivity over the suspensory ligament. And even though the suspensory looked fine, when we thermographed it, but you can see that there's still inflammation in it. We still have some inflammation. And even though we haven't got any anatomic change in it yet, it's still a problem that's being associated with that really hot splint. So you got not one, but 2 problems to treat there. Thermography will help your clinical examination because it gives you this objective measurement of the amount of inflammation. And especially when we start talking about rehab and returning back. So this is just a horse that has a stress fracture on a cannon bone. And the question always is, when do they get to go back? You know, and what we've used is utilizing how much inflammation's there. And as this inflammation dissipates, it's time to allow the horse to have some more exercise, because exercise can be very helpful in the healing process. Too much exercise can recreate the fracture. So you can utilize thermography to help manage that back, because I have this objective measure and I know how much inflammation is in that area. We've used it to get a qualitative assessment of vasculature and blood flow to tissues. So this is just looking at a wound on a horse's leg. Matter of fact, this was one of my former residents who was pretty proud of their job they did on this massive wound on the horse's leg. And then I decided I'd thermograph it. And then when I informed them that this incision was going to dehiss, we got into a strong discussion. And why did I know it was going to dehiss? Because I have good circulation over my flap. The flap's going to do fine. I've got pretty good circulation through most of it, but up here where you would expect the greatest tension, I have zero blood flow. And without any blood flow, you can't have any healing. So you know I'm going to get a small dehiscence in this area. But knowing that, I can start to treat this now and make sure the parts that can heal will heal, and the parts that I have to deal with, I can deal with that. And that's, the information is power, and I know where the issues are going to occur because I have that qualitative assessment of the vasculature. So what we'll see is when the skin distal to an injury approaches room temperature, that means a disruption of the vasculature has occurred. So we can see a couple more of those. So here's a foal that was stepped on at birth, and it came in, and it was pretty active, except it was lame on this right front leg. And you can notice that the whole foot, the circulation really stops, and the foot itself is the same temperature as the rest of the environment. This hoof is going to slough. No matter what you do, you can't do anything about it. The vasculature is gone down here, and essentially it's a permanent crushing injury to the vasculature. So indicative of loss of blood supply. Here's another one. This is a horse that actually had a laceration, and it came in. Colleague pulled out the thermographic camera, and you can see there's a clear demarcation. This particular client still wasn't convinced because so we did an arteriogram, and what you can see is that the vasculature clearly disrupts at the same place that you can see here thermographically, and on the arteriogram, it's complete disruption to the vasculature supply. We've also used it to look at that qualitative assessment of blood flow to tissues. And how can we use that? Is that exercise should increase the temperature of tissues. Why? The more you use them, the more blood flow you have. And when we've looked at pre and post exercise skin temperatures, we can then qualitatively assess the amount of blood flow. And one of the places we've looked at is looking at lower leg blood flow temperatures. And this was done particularly in conjunction with horses with palmar foot pain or navicular disease, or whatever you want to call it, but with foot pain. And we can see that some of these horses with foot pain do have circulatory, or associated with circulatory problems. In other words, the exercise that they do, the circulation does not increase. And until you can restore some of that circulation, either through corrective shoeing, etc., to get the horse to move better, to use that foot correctly and restore that blood flow, you can't get that horse sound. So let's look at thermography as an aid to training and rehabilitation. One of the places we looked at years ago was to look at horses in training. So we had the opportunity to go to one of the racetracks and evaluate horses, and we were able to follow 45 horses over 2 racing seasons and examine those horses on a weekly basis, and follow them along. And we were able to identify areas of stress produced by training. And the same would apply if I'm looking at horses and trying to evaluate stress caused by rehabilitation. Excuse me. So we were able to identify injuries 2 weeks before they became clinically evident. And by this, I mean, we'd go along, we could identify it, and then the veterinarian or the trainer would have to identify it, and we kept the information separate. And notice it was critical, and then we would tell. So that's a weakness of the program. But what we found was that about 2.3 weeks on average, we would see changes thermographically before anybody noticed them clinically. The horse wasn't taking a step, nobody felt any heat in the legs, etc. So we could pick these injuries up much early, which means if I can see them early, then I can modify the training, I can modify the rehabilitation so that the stress is taken off that and avoid injury or re-injury, if you will. So what we see is some heat coming up over a tendon in this particular case, heat over a cannon bone here. So this could be dorsal metacarpal disease. And then we see some heat starting over a distal hock joint, this here, that line right there. And we're able to identify problems that trainers just were not aware of, even though that. We can use it to look at shoes, etc. So hoof and shoe balance. So what you can see here, once you know the thermal patterns, the thermal pattern of the bottom of the foot is the sulci should be the warmest. The frog really shouldn't have a lot of heat in it, like you see here. And then what you can also see is that as this horse is creating friction, the most friction is at the toes. So the horse is landing on the toe here, but also landing on this inside heel here and getting away from this area. That's also associated, you can see the amount of heat in those heels too. Here's another case where you can see on the bottom of the foot, that's the normal heat in the sulci there. And you see that heat there in that heel, that's a person's hand right there. But now you can see here is increased heat friction on this side of the shoe versus over here, probably trying to get away from this potential pain source here. Or is this creating a disparity somehow and I'm getting more circulation there? That's the other things you have to figure out. But you can clearly see I have increased friction on the shoe there. So here was a case brought in years ago, and the whole complaint from this horse was that the referring veterinarian had sent it in for a foot evaluation, but the horse wasn't lame, and they really didn't want to change anything anyway, so we were wondering why they had even showed up. And here's one of the feet that was in question as you start to look at it. And you can see it looks like a little bit of difference, but not bad. We took radiographs of it. It's a low foot, but it's balance-wise, it isn't bad. The horse is leaning a little bit, decent enough. It could use a little more sole, etc. It could use some other little changes. But then when we did it thermographically, all of a sudden now, the slight subtle changes that you see here are much more evident. Boy, this horse, the coronary band is crooked. And not only is the coronary band crooked, but this outside part of this foot is taking a tremendous more heat along in here and creating a thermal pattern, inflammatory pattern, if you will. And if I pick up the bottom of the foot, so here's that outside of the foot here, I have a lot more friction. It's the same place as here. A lot more friction on this part of the foot than I do over here. So that horse is really loading that abnormal. So we came back and made recommendations to improve the loading here based to deload this lateral aspect of that and able to get the horse to travel a little bit better. Thermography can be used to look at other tack things. So here's just, we're looking at some saddle fit. It can be really useful for saddle fit. But here's one I have found useful. I don't know if you, in your practice, if you have anybody that doesn't ride very well and complains about a lot of things. And it can be really difficult to tell the client that that they don't ride very well or could use some extra help. And frankly, I found thermography to be a method. So here's two different riders. They're in the same, they've ridden the same exact saddles and same horses. And what you can see is this rider number one's fairly even, balanced all the time, rides nice. This rider over here is crooked. I mean, just there's no doubt about it, because we already know that the saddles are pretty good, but you have a crooked rider in this particular case. So this horse, if the horse is having problems, this is a rider problem, not another problem. And thermal imaging is the way you can get people to start realizing that. In my practice, I have found that a lot of my riders would rather be accused of being a pedophile than a bad rider. So you have to get them to come to that conclusion that they need help. So as we use it to look at saddle fit, again, it's going to give you a nice picture representation of the surface temperature. And the thing it does is it really creates an interface between the saddle and the horse, and the friction or heat that's generated between the two. And the saddle itself is where you can see the best heat. Oftentimes the horse, because that's all muscle, that may be a reflection of how the horse compensates for what's on his back. The saddle will show you how it's fitting and how it's sitting on those muscles. So the saddle becomes the best way to look at where things are touching. The horse will tell you whether the back likes it or not, and that can be useful. So this is just over those horses we talked about, where we did this study over the year number one was 225 thermographic scans on 45 horses over a 10-week period. 9 of those 45 horses were lost due to injury or chronic soreness. 3 horses had knee chips. 1 horse had a fetlock chip. 2 horses. What's important here is that we determined that we saw all those problems at least on average 2.3 weeks before they were actually diagnosed. We kept trying to get people to look at them, but you can lead them to water, but you can't necessarily make them drink. So it can be very useful looking at horses in training, and you can use it to help modify how you're training that horse to prevent that. Other things that we learned was that ligaments and icing really didn't interfere with the identification of injured areas as long as these things were done symmetrically. And in fact, putting horses in ice or in water can be useful in detecting it as long as it's done evenly, because inflamed areas, once they've been cooled down, inflamed areas become warmer faster than normal areas. So that can be used. One other thing that came about is we looked at maximal exercise within 2 hours did interfere with imaging, and the muscles had so much heat in them it was difficult to see anything. We found corticosteroids work, and they work really well. So thermography provided an excellent method to screen racehorses and to detect injuries before they were clinically apparent. And with that, that means if we can do it with racehorses, we can do it with any athlete in training. And in fact, you can do it with horses during the rehabilitation to prevent re-injury as you're trying. And then finally, utilizing thermography in a regulatory use. It's part of FEI's look at hypersensitivity. So in show jumpers, people occasionally will put irritating substances on the cannon bones or pasterns in order to get the horse to pick up its feet higher and jump more clearly. In the United States, it's also used to enforce the Horse Protection Act, which is an act that was passed to help protect the Tennessee walking horse from abusive training practices that induce through pain to get the horse to pick their feet up like that. So this is just the FEI regulation. Essentially, the way the thermography is used is all horses are scanned thermographically, and then the horses are palpated. We'd like to see each of them. I'd like to see the areas of inflammation and sensitivity on palpation, and we're going to use those to determine if the horse is hypersensitive, and if all parties agree, then the horse is hypersensitive. USDA, a little more complex. We're going to look at the horse all the way around because they may use soring in any way, and these are normal pictures. Anything that's not this is an abnormality and needs looked at further exactly. So those are the regulatory uses, but there's other uses that can fall into the clinical exam. I mean, again, pre-purchase examinations. I don't think a horse needs to be perfectly symmetrical to be normal, but if I run across a swelling, a flexion test or something that's odd, and I want more information, thermography is a great tool to use. Is there inflammation in this area, or is it thermographically normal? And if it's thermographically normal, I'm going to worry a lot less about it. Again, we've used it in pre-race examinations, doing the same ideas, is that there's a hidden injury there that there's a problem with. It's been used to look at track design and is the surface putting different stresses and strains on the horses. I think it could be used to look at footing in different arenas, et cetera, to see if the footing is creating strain. We've used it to study, look at the muscle use during the swimming, regular swimming, not treadmill swimming. This is regular swimming. Can use it in a dental exam. Here's just a quick example of over a maxillary area, a lot of heat there. Radiographs showed that actually the horse had a cracked tooth. We can look at TMJ disease, and we'll look at a few more of these. Use it to monitor CAS. You can use it to monitor the effects of therapy devices. There's so many therapy devices out there. Are they really having any effect? And now thermography, we've used quite a bit to look at the effects of those devices on circulation. So just for fun and giggles, here's a thermal image of a horse that's coming out of the swimming pool, and you can see they're just covered with water. You can't really tell anything. But if you wait, all of a sudden, the muscles that horse has just started to use, the heat in them. Again, it's the same thing with when the hottest parts start to warm up fastest, and what you can see is the musculature that's been used while that horse is swimming starts to heat up fast. So that when the horse comes out, you can start to get an overall scan of that horse. And what we found was that the horses that swim, they had different ways they swim, and they could be divided up into categories. Like this is a horse that I would have called a body swimmer. He swims really with his forelegs and his hind legs. He's not going to drown for anything. Here's a horse with TMJ disease. So this is the normal side. Here's the abnormal side. Why is it? Because it's colder, and it's abnormal because it's not being used correctly. There should be a lot of circulation over here. Looking at cervical facet disease, and here you can clearly see it. And in fact, we can even block the nerves over there, and you can see blushes how cervical facet disease can affect even the nerves that are coming out. So we know those patterns as well. So it can allow us to look at that horse's neck. This is a normal one. This is one with a hot spot in it. Come back and radiograph it. How bad's the arthritis? Is there arthritis? Is there other signs of disease? Horner syndrome, where I've got actually damage to the sympathetic trunk on one side. So I have this vasodilation because the sympathetic nerves are damaged. So here's one on the right side. Here's one on the left side, damaged to a little less extent. CAS monitoring. So instead of taking all the time to feel all around that, I can take and scan all around it and see what it looks like, and you start to see where you would expect a little extra over the fetlock area, palmar fetlock area of that foot. But thermography certainly has limitations. It is not all end all. It measures only surface temperature. And skin is only a reflection of deeper tissues. So you have to keep these things in mind, and you have to think physiologically whenever using thermography. And that could be a frustration for people because we, as veterinarians, we think anatomically. And this is true. There's a steep learning curve. I've taught several people how to do it and monitored their and just. Had we talked about the CAS?
Yep.
Okay, so we were here talking about just limitations. Skin's only reflection,
Yes.
steep learning curve, and then finally, thermography is useful diagnostic aid to assess lameness. I think it helps you increase your accuracy of your diagnosis. It confirms inflammation in palpably sore areas. And it indicates where further diagnostic testing should be concentrated. Ultrasound, radiography, whatever. But I think it helps you get to that spot. And you can use it during the course of competition. I have yet to figure out how this helps me diagnostically, but at least it makes cool pictures. So thank you for listening to me, and I'd be happy to answer any questions.
Perfect. Yes, we have a couple of questions.
Okay.
Diana, ¿querés preguntarle al doctor? Diana, ¿estás ahí? O Rita, si querés abrir el micrófono y le preguntan.
Okay. Hello, Dr. Turner. ¿Me escuchan ahí?
Yes. Yes.
Dr.
Yes.
Turner, hello. My name is Rita Roca from Uruguay. I was with you in 2009 in a course in Ohio, and I really understand thermography, and I work with thermography in my routine, but I really cannot imagine. I'm a regulatory vet. I work with racetrack, and I could not really use the thermography in the pre-race examination, and with the image that I saw, I really disqualify a horse that have no lameness, evident lameness. You see, it's not easy in the moment you check horses to really take them outside the competition with evidence, clear evidence. Imagine with the thermography. So I want your opinion, what you think, not in FAI. I know the FAI is perhaps different in the regulations, but in racetrack, do you think that we can arrive at a moment that we can use it to really take out a horse with a lameness, evident lameness?
I think it's most important in the racetrack before the horses get. I mean, so a real pre-race evaluation where you can do it, and it'll show you a hot area. And to me, it has to correlate with the exam as well, so that where we found at our track it was most useful is that the regulatory veterinarian has the say over whether the horse races or not, but the thermography, they're able to stop more arguments when a trainer disagreed with what they found and go, look, here's the heat as well. You know, I mean, he's got pain, he's heat, you know, this is our opinion based on all these things. And I think it's just one more factor. I would see thermography at the track much more important in that training thing, because the problem is whenever you get to a competition, everybody wants to compete, and they're less willing to look at potential things that'll keep them from competing. And it's a tool, and but the final assessment really has to come down to the veterinarian. So so that probably doesn't answer your question, but that's how I think we use it, is that the veterinarians, we have to get people using it enough to have enough confidence into it that we can do that. And confidence in is to have overnight. Does that make sense?
Yes, thank you. That's similar what I think. That is not so easy. And one question more, the last one. Sometimes I have difficulties early in the morning with the horses that really I do not have good images when I go early in the morning, and I have to take the horse outside to trot and to do something first.
Yes.
But I really find difference when they use the racetrack. In the thoroughbred, people love to use icing to ice. So I really find difference when they use icing and when not. But you put in your presentation that you didn't find them when you ice the
well, you know when they've been iced, though, don't you? Yeah, you know when they've been iced, and yeah, it's what we found when we were doing the racetrack, and at our racetracks, you're not supposed to ice the day of the race. And it's like going, yeah, they did. And because you can tell.
Okay,
and
perfect.
Yeah, I mean, if you sit there and you have to change your scale, but if there's a hot spot in that ice, it'll show up. It may not going to show immediately, but it'll be the area that warms up the most. Or it'll warm up faster than another area where it's iced.
Yes, perhaps depends on the type of lesion. The more the chronics or not hotspot is easier to find than the other one.
Yes.
Okay.
And the other problem with the morning stuff is that it's just like you and I, when we wake up in the morning, if it's been cool in there and you're not moving around, you don't have any peripheral circulation. So you got to get around to make it move. The other thing that we've had friends with problems too in thermography was that in places like Arizona where it's really warm, and during the course of the day, they could not do thermography during the middle of the day because the ambient temperature was the same temperature as the horse. And yeah, everything's 100 degrees. So it's hard to differentiate anything. And the horse is sweating and makes it really hard. So those horses had to be looked at early in the morning and brought out and exercised so you can get circulation. But again, this is that you have to think about physiologically what's going on.
Thank you so much for the answer.
Mauro, preguntarle a la de Diana, porfa, que Diana tiene problemas con su micrófono. Y hay una de otro colega de Brasil. A ver, ya te digo. Mauro, ¿estás? Paulo Márquez,
Ahí estoy.
y la de Diana.
Descubrí que si abrís el chat te bloquea el micrófono. Bien.
Sí.
Diana va a preguntar. No puede preguntar, ¿me dijiste?
Sí, no puede preguntar porque tiene problemas con su micrófono, así que
Tracy, I have a question from Diana Facchini from Colombia. She asks she say, in fact, if a horse hit a pool, can give a hot spot in the thermographic examination if the horse hit a pool. Can you see a hot spot and then confuse with application of something else? Can you hear me?
So you're talking relative to for FEI? So I mean, here's how the regulation goes. If the horse hit a pole and it created enough of a hotspot, and it's possible to do that, and the horse shows a hotspot and sensitivity, the horse is too sensitive to compete, meaning that horse hit that thing so hard it can't compete. Nothing was done wrong. Nobody's manipulated this horse, but from the rules standpoint, from a welfare standpoint, that horse is too sensitive to compete.
Okay.
So yeah, the hypersensitivity rule doesn't say whether anybody did anything wrong or not. It just says whether the horse is too sensitive to compete.
Okay. And also she asked if bandage of boots has been taken off how long before the examination when you prep the patient for evaluation? How long you remove the bandage in regular horses? In lameness, regular horses.
Well, when I do regular horses, it's best to remove the bandages 2 hours before. Clothes, anything, clothes, etc. You know, yeah, bandages, blankets, etc. Remove them 2 hours before. Bandages hold in heat really well. So if you can remove them, that's much better. Otherwise, you have to try to read through the artifact, and that's more difficult.
Okay, I have the last one that Gustavo Adaro asked me. He has a thermographic examination. Gustavo is from Argentina, Mendoza. He asked me if when you check, for example, the hoof, you just use a thermographic pattern to compare, or you use the numbers itself, the temperature. And if you have like how many degrees normally has the hoof in regular horses, or just you use the pattern?
I just use the pattern. And
okay.
Yeah, so the coronary band should be the warmest. If the coronary band is getting wider and wider, that's usually a sign of inflammation in the lamina. And you can see this as a laminitis case, or you can see as a focal wall injury in a heel or a quarter, where the heel will be the same temperature as coronary band. And that's, I find that much more accurate, because absolute temperature, is not accurate.
Okay, perfect. I don't know if there are, no sé si hay otra pregunta.
Sí, hay dos preguntas. J. Paulo la va a hacer él y después Marina. Pueden arrancar, por favor.
Bien.
Okay, so Dr. Turner, I'm not sure if you hear me. So this is Paulo Marques from Portugal. I have a question for you. For those cases where you have the sympathetic dysfunction, so the colder limb from carpus or from hop down, but when you have it asymmetrically, in other words, you just have it in one of the forelimbs or one of the hind limbs, in otherwise apparently asymptomatic horses, can you give us some hints on how to try and evaluate what kind of significance we can give those cases?
So the question is, does the sympathetic dystrophy, like in humans, occur in horses?
Well, sort of. You can answer in any way you
like. Or are you talking about those horses that have a really cold, you come out and they're really cold distal leg? Yeah,
but just one, just the leg. Yeah, exactly. Just one leg.
Just one, right. So if I see that, that I'm going to exercise that horse for 10, 15 minutes. If that's real, it won't warm up. If it's probably, and I think a lot of these are just purely physiologic stuff, most of those will warm up as soon as you exercise them. I mean, so they're sympathetic, but it's vaso. I mean, where I live here in Minnesota, horses' legs disappear during the winter. I mean, I literally can't find them, and I can't lower the temperature enough because they just become so cool. They're the same temperature as they emit they're not emitting any heat at all, same as the environment. But if you wait, what you will see is that a whole leg, one only, will vasodilate. And a horse will, that leg will warm up for a while, and then it'll vasoconstrict again, and another leg will vasodilate. So I think it works the other way around too, that a horse will vasoconstrict one leg, especially, you know, in a box stall, etc., or in places it's a little cool in evenings. So this would be kind of like trying to look at people's, looking at our fingertips as the environment changes. So that's why I think it's important, if you see that, it's necessary to exercise them, because if it warms up with exercise, it's not a sympathetic dystrophy. It's not over sympathetic tone. Exercise overdid it. So as soon as the animal had a need for the circulation, it opened it up. If you have a dilation, then you can put them in ice, and if the sympathetic system is working, then it should vasoconstrict. And if it doesn't, then you know the sympathetic system has been damaged. So that's how I try to put significance on that or not. And in humans, that syndrome is supposed to be painful. You know, I think we may have some syndromes in horses similar to that, but it's very difficult to document, and I've yet to document one that I've convinced truly dealing with that, and not just a temporary one. And you'll see some of these in like horses with navicular problems that you can't, they're having a hard time increasing their temperature, but it's like you take away inside of that and you improve the mechanics of the foot, the circulation problem changes back to normal. So it's not a true sympathetic dystrophy, if you will. Am I making sense here?
Yes, absolutely. Thank you.
But I think it's out there.
Okay, Marina, tenés una pregunta.
Hello, thank you, Doctor, for your presentation. I have a question, because my question is, so many devices of thermography, they have maybe different colors of temperature. When it's hot, can be white also.
Yes.
So yeah, and if I see white color too much, I can say that is temperature higher than red color. Yes or no? Or it is more inflammation or more blood circulation when I see white spots, big white spots.
Yes, if you're seeing white spots, those are the warmest. When I set up my camera, I try to set it up so that on the animal that I'm looking at, there is no black spots and there is no white spots, so that everything is in the color scale. And yeah, I try to have a 10 degrees centigrade color scale to cover everything, which works most of the time except during winter.
Yeah, and when I see in withers white, because we have a horse with inflammation under the supraspinosus ligament, it was 2 withers and between scapulas, too much white spots. Because we make thermography, it was a little bit strange, because localization of inflammation was only to the right side and not so big. When we see in thermography device, it was big spot in the right side and big spot in the left side. So what do you think about this?
Well, and where did you see these big spots? On top of the scapula?
On top of the scapula, middle of scapula, and goes under the supraspinosus ligament, like half scapula and under the top of the horse.
Yeah, so I mean, what you might have been saying is some inflammation in the bursa. There's a bursa that sits right behind the scapula.
Yeah, I know this
There's
bursa,
a
but this bursa was
suprascapular
like,
bursa up there.
looks like okay. It's just was little bit under bursa, but I think if it will be bursa, this is colors. I can see little bit smaller or little bit goes not so diffuse area, or it can be bursa gives so diffuse area in the muscles and the scapula also.
So did you ultrasound this area to see if you could see any anatomic change?
And in bursa it was just normal and little bit maybe mineralizations, but I think mineralization cannot give such a big inflammation. And also this area was hot even if you touch with your hand. So it was very difficult course, and many people look at this course and we make many things, but it's still like hot in the right side and in the area when it's rhomboid and trapezius muscles. Maybe people we think maybe some abscess or some infection, but it looks like it's not comes from bursa. It looks like it go from deeper tissue. I don't know.
So so it's from the fascia or the muscle tissue there then.
Yeah. And also I have a question. If it's important, you angle, you should make this evaluation from 90-degree angle, or it change color when you change your angle, and also when you have sunlight.
Yeah, so I think it's important to make your evaluation at 90 degrees or as close to 90 degrees as you can get.
Yeah.
Because it does change a little bit as you move off your angle. And I like to look at them from two different directions to see if it's consistent, because it'll change sometimes.
Yeah. And when you
but yeah, I agree with you.
Yeah, when you make this evaluation and just you see too much sunlight, because sometimes it is open windows. We have in Ecuador a lot of light.
Yeah.
Can sunlight make some influence of colors of the scan of thermography, or no?
Yes.
I don't mean when its course was like 15-20 minutes under the sun and the skin get warmer. I mean when you have direct evaluation, you see a lot of sunlight that comes from one side. Can it make some difference in the picture also, or no?
Yes. No, and it can happen. Sunlight will do it immediately.
Yeah.
And you can take a horse out, and if it's the sunlight coming on one spot, that will be the hot spot.
Yeah. Okay.
And it happens really fast. Yes.
Yeah. Thank you very much.
Yeah. For sun is the most, to me, is the most important artifact that you need to control for. I mean, sun and then a breeze. You need to block the breeze, because both of those will make a big effect on your thermal.
Yeah. Okay. Okay. Thank you. Thank you very much.
Mauro, vamos despidiendo y cerrando. Mauro.
Yes, Tracy. Okay, this was the last question. We really thank you for your participation in this round of talk that we have here in Latin America. We really thank you very much, and hopefully everything is fine in Minnesota. Please say hi to Julie and the kids.
You're very welcome.
Thank you.
All right.
Yep.
Thank you. Thank you.
I will. You won't recognize the kids anymore. All right. Take care.
Bye-bye.
And have
thank you.
Stay safe. Bye-bye.
You too.
Good night.
Bye-bye.
Good night, everybody.
Thank you very much.